Good evening, everyone. I am Dr. Mithilesh Chandra, Senior Pathologist. I am Director of Pathology Consultancy Services and I am CEO of Digiscan, which is a leader in digital pathology. I founded this company in 2011 for using the digital pathology platform for enhancing medical education in our country. Now, since we have completed 11 years of our existence, we want to look back at the contribution Digiscan has made in transformation of pathology education by digital platform. We can divide our activities in pre-corona period and post-corona period. In pre-corona period, the emphasis of our educational products was on preparation of digital slides. And during post-corona period, this emphasis has shifted considerably. Before the corona outbreak, we at Digiscan were concentrating on preparation and exposition of fully annotated and labeled slide sets on all topics of pathology. In the next slide, we can see list of various digital slide sets which were prepared for MBBS students and junior and senior pathology residents. We have prepared digital slide sets of histology and pathology for MBBS students as per the guidelines of National Medical Council. And we have also prepared fully annotated and labeled slide sets of histopathology of organs and systems comprising of more than 2000 slides. So we have covered most of the systems and organs in our slide sets of histopathology. Then we have set on hematology, which includes images of peripheral smears, bone marrow aspirates, and bone marrow biopsy of all hematological conditions, and this set contains more than 200 slides. We have another very popular set of gyne and non-gyne aspiration cytology and effusion cytology. These sets are very popular among postgraduates. Then we have a set on immunohistochemistry where digital slides of fully worked up cases have been presented to the postgraduate students. We have a very popular set of dermatopathology which is used equally by the pathologists and dermatologists, and this set has more than 500 slides. And lastly but not least, we have a set on MD pathology quiz cases. This set is meant for assessment of students by the professors and for self-assessment by the students. When we talk of the slide sets, we have, as we can see here, slide sets for MBBS. First, let us take up MBBS, and we have a set of histology for MBBS students and a set of pathology for MBBS students. The students can see the slides of the histology of all the organs in this set, like this slide of appendix. We can see that this is appendix and all the layers have been annotated. Here we see lumen of appendix. This is mucosa, this is submucosa, muscle coat, serosa. So student while studying the slide knows everything about the microscopic features of appendix and how mucosa looks like or how submucosa. So it is a great method of learning about the histology of the slide. And this set is very useful for the MBBS students, similarly, we have a set of pathology slides for MBBS students. And like we have a case of acute appendicitis here, we have just seen a slide of histology of appendix, and now we have a slide of acute appendicitis. So we can see the difference in the morphology of the appendix in normal and inflamed condition. And like that, the students can study the mucosa which is inflamed, submucosa, muscle coat, and the serosa, all showing signs of inflammation. This way, these students can revise the slides before their exam, and this will be very helpful in passing their practical exams. When we talk of the histopathology slide set for the postgraduates, we have divided the slides into various sets. Like we can see here that the slides have been divided into gastrointestinal tract, respiratory tract, cardiovascular system, urinary tract, endocrinal glands, and so on and so forth. If we see slides of gastrointestinal tract, we have further divided the GIT into various organs like esophagus, stomach, small intestine, large intestine, liver, pancreas, gallbladder, etc. So it makes the student easy to study the pathology of a particular organ. Then, in some cases, we have divided the slides into different categories. If we see the slides of central nervous system, we will see that we have divided them into infections, tumors, and miscellaneous conditions. Let us see what we have done in lymphoreticular system or lymph node. We have slides of infection, benign tumors, malignant tumors, miscellaneous lesions, and spleen. So it is very easy for any postgraduate students to localize the slides of a particular system organ, and in that also to localize slides of infections or tumors or malignancies. If we go through this list, we can see that we have covered female genital, male genital, soft tissue tumors, bones, breast, ENT, then bacterial fungal infections, then skin, salivary gland lesions. So all sets have been covered in these slides. And then we have a chapter of oral lesions, which the MD student has to know. So we have provided them with common oral lesions which come into practice of a general pathologist. Then, in addition to histopathology sets, we have a set of organic cytology, and in this we have provided images of LBC slides as well as conventional pap smears for students to familiarize them with the cytological changes seen in the conventional as well as LBC smears. And this set is very popular among postgraduate students. Then we have a set of non-gynae cytology, which is basically dealing with the aspiration cytology and all the superficial palpable lumps like salivary glands, thyroids, lymph nodes, breast, soft tissues, bone, joints, skin, etc. have been covered in these sets. Then we have a set on effusion cytology. If we see effusion cytology, we can see that we are covering with infectious conditions like tuberculosis or reactive effusions or malignant effusions. So various pictures to familiarize the students with the cytology of the effusion. Then we have a very popular set of hematology where images of all peripheral smears, bone marrow aspirates, and bone marrow biopsies are given, and this has been divided into normal and anemias, leukemias and other malignant conditions, infections and other disorders. If we see anemias and normal peripheral smears, we see that in anemias also we have taken care to show pictures of bone marrow aspirates and bone marrow biopsy in cases wherever it is pertinent. Then we have a very popular set of dermatopathology, which has more than 500 slides, and the slides have been given code numbers depending on the group of diseases which they belong to. Like point 1, it belongs to lichenoid lesions. Point 2 belongs to the psoriasiform lesions. So like that, there is a coding of the slides. It becomes easier for the students to go through the slides since they belong to the same group instead of having haphazard arrangement. And each slide, as I said before, it is very properly labeled. We can see that the labeled here, and then the theory description of the slide is given. Once the student reads through this description, there is no need to further consult the book. This has been given exhaustive description of the slide, including the clinical epidemiology and microscopy features. So this way, these slides and this slide sets are unique. They have extensive annotation and labeling, and they are very useful for the postgraduate students. And these cases are very helpful during examination because at a short glance they can know all the features of the disease as well as they can study the microscopic features. Then we have a set of MD exam cases. As I said, these cases are quiz cases. Some are simple, some are tough. These are meant for assessment either by the professor or by the students themselves for self-assessment. We have divided this set into two. One is MD exam cases, and where the slides are shown, I'll show you. And second is the answers of the MD exam cases. Now let us see the first set where we have given the code number and the slide is provided with a short history. So with this short history, the postgraduate is supposed to make the diagnosis on the lesion, and once the diagnosis is made, then that person can go to the answer folder and check the diagnosis. Under the same code number, the same slide has been explained with the answer. So the answer is angiosarcoma of the parotid gland, and this is the description of the angiosarcoma of parotid gland, and this is the labeling of the features of microscopic features of the angiosarcoma. So like that, all the organ systems have been taken care of to be included in the quiz cases, some cases from each system. And then lastly, we have a set where we have provided IHC cases which are fully worked up. Now let us see this set. Now suppose we have a case of myofibroblastic tumor. So we provide the HNE image and then we provide the IHC workup of the same case, and the case is discussed in detail for the IHC markers. So like that, as you can see, we have tried to provide large number of images which are labeled for the postgraduate student to learn pathology and to pass their examination with much more ease if they go through these slide sets. Then what happened? As you all know, we had a period of corona and that disrupted the whole routine of everyone in the world. There were restrictions on the movement during corona outbreak, and the students were not going to the colleges, professors were not going to the colleges. So Digiscan decided to help pathology postgraduates in continuing their education with the help with the basic idea of eliminating gaps in the knowledge, elevate the standard of pathology teaching, make education accessible globally using online platform, and for this to achieve this goal, eminent national and international pathologists were requested and they contributed to this program, and the courses were conducted during corona period, and they are listed later on. So in the post corona period, the emphasis of Digiscan shifted from slides to uh, online lectures, webinars, and courses. And that was appreciated very much, and these courses became very popular, and we are still continuing with this activity. Now, for helping the MBBS students, we, as I said, that we have slide sets of histology and pathology for MBBS. We are now in the post-corona period offering them videos in English and Hindi explaining microscopic features of the lesions which have been approved by National Medical Council. This resource material will help the students in understanding their pathology slides and other practical topics, as the features of the slides are very well explained in the videos. Students can see these videos prior to their exam to revise their pathology slides. Since Government of India has permitted MBBS teaching in Hindi as well, videos have been prepared both in English as well as in Hindi. Students finding difficulty in English language will find Hindi videos extremely helpful. Here we are showing you video of a slide in English and in Hindi.
The appendix is divided into 4 layers: mucosa, submucosa, muscularis propria, and serosa. The inner lining of the appendix is covered by a glandular epithelium with intestinal mucous glands, and these glands are lined with epithelial cells, that is, the simple columnar epithelium, and a high number of mucin producing goblet cells. अपेंडिक्स, जो एक नॉर्मल अपेंडिक्स माइक्रोस्कोप के नीचे कैसा दिखता है, अब वो देखते हैं। ये है इसका ल्यूमन। अपेंडिक्स की विशेषता है कि इसका जो ल्यूमन होता है वो संकीर्ण होता है और मुकाबले में इसकी दीवार जो होती है वो मोटी होती है। इसकी मुख्यतः 4 परतें होती हैं। पहली परत को कहा जाता है म्यूकोजा अथवा झिल्ली। म्यूकोजा की भी आगे 3 परतें होती हैं। जो सबसे पहली परत होती है यानी कि म्यूकोजल लाइनिंग, जिसे कि लाइनिंग एपिथेलियम भी कहा जाता है, ये होती है टॉल कॉलमनर लाइनिंग विद इंटेस्टिनल टाइप म्यूकस ग्लैंड्स।
Then online products which were produced in post-corona period were the video lectures. Now, video lectures have been prepared separately for first year students of MD or DNB and for senior students because their knowledge is very much at different level. The video lectures of basic pathology are prepared for fresh entrants to MD and DNB pathology, explaining gross examination of organs and approach to microscopic diagnosis of pathology slides. Such 40 short videos have been prepared to help them to revise their MBBS pathology. Online courses on various aspects of pathology, including extensive coverage through more than 200 lecture videos of histopathology of all organ systems, have been prepared to help the postgraduate students in going through their course. We have prepared hematology videos, including interpretation of bone marrow core biopsies. These videos are extremely popular. Then we have videos, lecture videos in cytology, clinical pathology, microbiology, blood transfusion, immunohistochemistry, dermatopathology, and many more subjects like head and neck pathology, oral pathology, and others have also been covered in these lectures. For complete list of our videos, you can visit our website www.digiscan.co.in. Here are some examples of the videos produced by Digiscan.
The talk today will be outlined by these certain topics. I will discuss a little bit about the technological principles of hematology analyzers. If you look at these microcytosis coming to the RBCs, WBC normal, hemoglobin 8.2, MCV 59. You can see WBC histogram is okay, normal, but RBC has shifted to the left, showing that it is starting from the earlier y-axis. And this is because there is severe microcytosis. Similarly here, it has shifted to the left, and this is microcytosis. Another important thing you must see, it is not touching the baseline here. On the y-axis, there is little high initial start of the curve. If you look at your platelet histogram, you will understand why this is happening. Because there are many RBCs which are very, very small. So we will be talking about FNA technique, what are its advantages, disadvantages and contraindications, what are the various steps, how do we process the sample that is obtained during FNA, whether it is solid material or fluid material, what are the common stains that are used and what are the advantages and disadvantages over each other, what is rapid on-site evaluation, how do we use it for dividing our FNA material for various purposes, few words about image guided bineedle aspiration, and finally about health and safety of the person who is performing fine needle aspiration, what are the precautions to be taken, for example, for a needle stick injury. So we will start with how to approach to thyroid nodules, which is our time-old tested triple test approach. When we are doing clinical evaluation, what are the important aspects? Then how our radiologists assess it, and when we get one particular grading, how do we take it for cytology? What is the role of FNA in thyroid lesions? What are the limitations? How can we improve diagnostic accuracy? And then we will talk about the reporting system and various categories. So we can do with the syringe and handle or non-aspiration technique. For particularly for thyroid, we recommend non-aspiration technique, which is much more sensitive and get almost blood-free aspirate. Since thyroid is a very vascular organ, it gets diluted with blood very easily. So this is just to show you how you can get the foamy macrophages with some adjusted material and some small clusters of follicular cells with little bit of hemorrhage in the background. So this is some colloid also in this. So it's quite suggestive of a cystic colloid nodule. So it can, you can, if it is matching with your clinical and radiological data, you can safely sign it as benign or negative category. However, in other cases, you might get some follicular cells which might show you, like this one is showing you pseudo intrusion or some nuclear groove. Then there is a definitely high suspicion of papillary carcinoma, and this will go into suspicious category and not unsatisfactory category.
Then another activity we have started, YouTube channel has been started to help the postgraduate students to study the pathology material, which has been presented in the form of interesting cases or quiz cases or lectures on various topics, and the lectures have been delivered by renowned faculty. And most of these lectures are highly popular among postgraduate students and young pathologists. So this channel is a very prestigious activity of Digiscan. Another activity we are going to start very soon is case of the fortnight, about which you will come to know very soon. Now here we have our YouTube channel, Digipath tutorials, and we can see that we have here the videos, as I was mentioning you, of the pathology. Then we have videos of the lectures delivered by many pathologists. We have here case discussions, interesting cases, discussion of interesting cases. Then some of the lectures delivered by various faculty members. And then we have some quiz cases. Here we have a quiz case here, another quiz case here. So this channel is basically designed for postgraduates to help them in going through various interesting cases, and some of them are very unusual. Something like we have a parasite here, it is a very unusual parasite. So if the students go through this case, they will come to know about this parasite, and it helps them in increasing their knowledge about various uh, topics in pathology. So friends, we have told you all about Digiscan and its products and how these products are helping the students, medical students, whether MBBS or MD pathology or DMB students. And if anyone wants to get access to the educational material, they can contact us at the given details. We also have a activity of group subscription which entitles the subscribers for group discount. People can take advantage. Many students can meet together and give the subscription, and all of them will get the group discount. And this group discount is entitlement is 5 or more postgraduates together. So I hope that after listening to this, you people will form groups to get advantage of the group discount. Thank you very much.